2019 is a respiratory disease caused by the novel virus SARS-CoV-2. This agent is responsible for the current pandemic that is spreading worldwide. The World Health Organization was informed of an outbreak of pneumonia of unknown cause detected in Wuhan, China in December 2019. Today we know that infectious agent was a virus of coronavirus family which was named SARS-CoV-2 that causes respiratory disease called COVID-19. The term COVID-19, CO stands for corona, VI for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. The COVID-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndrome, SARS, and some type of common cold. Symptoms can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. The disease can be fatal. These symptoms are similar to the influenza or the common cold, which are a lot more common than COVID-19. This is why testing is required to confirm if someone has COVID-19. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air and quickly fall on the floors or surfaces. You can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19 or by touching a contaminated surface and then your eyes, nose, or mouth. Older people and people with chronic medical conditions such as diabetes and heart disease appear to be more at risk for developing severe symptoms of coronavirus. As this is a new virus, we are still learning about how it affects children. We know it is possible for people of any age to be infected with the virus, but so far there are relatively fewer cases of COVID-19 reported among children. There is no currently available vaccine for COVID-19. However, many of the symptoms can be treated, and getting early care for a health care provider can make the disease less dangerous. There are several clinical trials that are being conducted to evaluate potential therapeutics for COVID-19. Doctors, nurses, and healthcare workers have become the unwitting heroes of coronavirus pandemic, winning applause from balconies and streets around the world. Hospital workers are dealing with a huge influx of patients while also facing a lack of equipment in many cases and the fear of becoming infected themselves. The virus spread around the globe in no time. Number of reported cases kept on increasing exponentially with each passing day. The virus has not only received its widespread in media coverage but also caught the attention of scientists and researchers who have been analyzing the virus, the disease it causes, and how it spreads. The government of Pakistan practiced a number of effective measures to restrain coronavirus outbreak in the country. infections like the flu or the common cold, public health measures are critical to slow the spread of illness. Public health measures are everyday preventive actions such as staying home when sick, covering mouth and nose with flexed elbow or tissue when coughing or sneezing, dispose of used tissue immediately, washing hands often with soap and water, cleaning frequently touched surfaces and objects.